Good evening, everybody. Thank you for joining us tonight. With us today, we have Dr. Ivy Branin. She's a naturopathic doctor in New York City, which means that she does not approach disease with a one-size-fits-all perspective. Instead, she sees each patient as an individual with their own potential for optimal health. Dr. Ivy supports people in their desire to feel healthy and feel good about themselves using the naturopathic principles of dietary and lifestyle management, homeopathy, visceral manipulation, botanical medicine, and craniosacral therapy. That was a mouthful. So I guess without any delay, I'm going to turn over the presentation to Dr. Ivy.
Thank you so much, Donna, for having me again. And I always like presenting for Genesis Fertility. I think you guys do amazing work. And so tonight I'm going to be talking about endometriosis, and I'm going to focus on dietary strategies on what to eat and what to avoid if you have endometriosis. And so as Donna already talked, she gave my bio. I am a naturopathic doctor here in New York City, though I'm doing most of my work currently remotely, but I am coming to you today actually from my office in the West Village. And the primary focus of my practice is women's health. In fact, actually, prior to doing this presentation tonight, I actually had a endometriosis patient. So it's a condition that I've seen very, very often in my practice. So whenever I present, because I realize that a lot of viewers, people, they're not familiar with naturopathic medicine, I like to briefly talk about what exactly naturopathic medicine is. So naturopathic medicine is a patient-specific system of medicine which utilizes natural therapies to stimulate the body's own healing potential. And the main things that I like to think about with naturopathic medicine is our guiding 6 principles. So the first one is first do no harm, which is very typical of all of the healing professions. The other is prevention is the best medicine, and that's something also that I would definitely consider when looking at an endometriosis case. The healing power of nature. We believe that our bodies have this intelligence that if you give it what it needs, it will heal. Now, this presentation in particular really does talk a little bit about this whole idea around identifying and treating the cause. So we, as much as possible, try to not just attack symptoms, but really going to the root of why those symptoms are occurring. Doctor as teacher. So here I am presenting, but even in my practice with my patients, I really try to explain not just like the pathology, but also what is going on in the body. And lastly, treating the whole person. So it's not just about what someone is eating, but it also can be about relationships, environmental factors, which actually in this presentation, I will be discussing some of the environmental factors of endometriosis because that also does play a lot in the dietary strategies of helping with endometriosis. So I figured since I'm presenting for patients of a fertility clinic, I thought it would be important just to talk a little bit about endometriosis and its role in fertility or fertility problems. So endometriosis is very strongly linked to infertility. In fact, it's estimated about 30% of women who have endometriosis will struggle with infertility. And then on the other side of that, about 30% of female infertility is associated with endometriosis. And I view it in a couple of sense. Endometriosis in a direct way, presenting fertility challenges, but also some of the factors that cause endometriosis or aggravate endometriosis also impact fertility. So a couple other statistics about endometriosis in that it not only does it one of the main ways that it does affect fertility is it one causes challenges in conception or conceiving, but also is associated with an increased rate of miscarriages. And so, for thinking about endometriosis alone, some of the issues that are presented are the scarring of the pelvic cavity. Can actually impact the movement of sperm and eggs, so that can cause a challenge. Also, we're seeing that the majority of women with endometriosis, though this can present challenges, they are actually able to conceive and even have full-term pregnancies. But the other aspect besides the actual scarring of the pelvic cavity, also adhesions to the ovaries or the fallopian tubes also can increase the risk of ectopic pregnancy. And then as I go through the next few slides, so that's more just like from a structural issue of why endometriosis can present fertility challenges. Some of these other underlying causes or aggravators, I would say, of endometriosis also could be also impacting fertility. So this is not a complete list of all the potential causes of endometriosis, and it's very common, at least I've seen in my practice, that many of my patients will fall under a couple of these. Of course, there's other factors, but I figured it made the most sense to kind of focus on the causes and factors that are definitely can be improved through diet, or also that are changeable. So there are not obvious, but there is also a strong genetic component to endometriosis, and there isn't as much that we can really change about that. But these are definitely some factors that we can actually really address. So the first being inflammation, then estrogen progesterone imbalances, environmental toxins, and poor digestive health. So looking at inflammation, so I think often when we think about endometriosis, we think a lot about hormonal imbalances, but a lot of the research, specifically in the past 15 years, really has confirmed that endometriosis is more of an inflammatory disorder. And so it has appeared that in women that have endometriosis, that there's a higher production of these various pro-inflammatory chemicals or mediators, things like cytokines, leukotrienes, and prostaglandins, and that they're being overproduced. In fact, actually, they've been able to actually extract them from the pelvic cavity. So really showing that there's a lot of inflammatory markers. And one of the big things about in any kind of strategy for endometriosis is doing a lot of focus on inflammation and really to reduce the overactive immunity. So one of the other things is sometimes we might even consider endometriosis in line with an autoimmune condition, for example, and that actually there have been even some studies showing by the reduction of this inflammation that it can really help with, again, if we're thinking about endometriosis as a challenge for fertility, but by reducing the inflammation can actually really help with ovulation and conception. Okay, so estrogen and progesterone balance, and I think that this is something that maybe we're more or less aware of as a potential either aggravator or cause of endometriosis. And so the main thing, so if we think about estrogen and progesterone. So the first half of our menstrual cycle is called the follicular phase. So that's basically everything that happens before ovulation, and it's very much governed by estrogen. And then after ovulation, which is the luteal phase, is very much governed by progesterone. So when we're actually thinking about estrogen progesterone balance, we're really thinking about the balance between these two hormones at the second half of the cycle. So during the luteal phase, And basically also just some other things about estrogen and progesterone. So estrogen is really what helps to build up the endometrium, the uterine lining for implantation, and progesterone is basically the hormone that helps to maintain that uterine lining, the endometrium, for the potential of implantation. And if those balances are off, definitely can result in fertility issues in general. And then again, we're thinking as far as that estrogen and progesterone can really impact endometriosis. So some of the things to note is when you have excess estrogen, and whenever I say excess estrogen, what I'm really talking about is excess estrogen in relationship to progesterone. We're going to be seeing growth of endometrial tissue. In fact, actually, high estrogen to low progesterone state, specifically in the luteal phase, um, has this effect. And there's definitely different reasons where this imbalance can occur. So one, it can definitely be from ovarian dysfunction. Also, our adrenal glands have a big impact in how our hormones are being produced, and then also how our thyroid is functioning. So that's sort of more of like an other endocrine organs or glands that are also affecting this balance between estrogen and progesterone. But I wanted to kind of talk a little bit more about some of more the either the dietary or the environmental factors that can throw these into out of balance. And so if we're thinking about excess estrogen, one of the big sources, unfortunately, is a lot through our environment. So we have these things that we call xenoestrogens, so basically foreign estrogen, or also sometimes we might call them endocrine disruptors. The primary sources of these chemicals are in plastics, and we use a lot of plastics from our drinking, if we're getting Evian or Poland Spring bottles. Maybe we're getting a lot of takeout or using a lot of plastic containers specifically to store our food, and it gets worse when it comes in contact with fats and heat and acid. So these are definitely finding their way into our food and causing hormonal imbalances. The other sources are household cleaners. I mean, that's not so much about diet. And then some of our personal care products also might have some of these chemicals that might be causing some hormonal imbalances. And one of my favorite sites for learning more about trusted brands or cleaner brands is the Environmental Working Group. And so I highly recommend, it's ewg.org. You can find out more information on some products to avoid. The other big source, besides like plastics and some of these household products, is actually non-organic meats and dairy. So these also can be a high source of some of these chemicals, specifically actually dioxin. So dioxin we find in bleach, but the bigger component of where we might be getting it is through these non-organic animal sources and dairy. So that's more like from the xenoestrogen aspect. The other thing that can throw off the estrogen to progesterone balance is anovulation, which means basically not having ovulation. And so without ovulation, we're not going to be producing progesterone, and that's also going to throw this out of balance. And of course, if we don't have ovulation, that's also going to be causing fertility issues. Liver. So our liver actually detoxifies all of our hormones. So if our liver is either being overly taxed with detoxifying alcohol, or if we have any kind of anything that's basically preventing our liver to be functioning optimally, that can throw this out of balance, as well as high insulin levels. So if our blood sugar is out of balance, that is actually going to increase estrogen activity and can then lead to more of these endometrial lesions. So those are some of the factors that are going into this balance. So I did talk already a lot about environmental toxins, and one of the interesting things about all these kind of causes is that they are very much like interlinked. So I did talk already a lot about the plastics and some of the contaminants that we're finding in our food system. And I just wanted to again bring up dioxin, as that is found, again, it's in bleach, and so can find its way in a lot of our paper products, or also sanitary napkins and tampons. So definitely that's something really to look out for. In fact, actually, of many of these different environmental toxins, dioxin actually has been the most studied when it comes to endometriosis, and that actually the more of this substance found, we're seeing worsening of symptoms. So that's something definitely to really consider, being more mindful of some of the products that you might be purchasing and using on a daily basis. And lastly, poor digestive health. So this, I feel, is like a little bit more new as far as what the research is showing. And it is one of these things where which came first, the endometriosis or digestive issues. But first off, that many patients that are suffering from endometriosis also have bowel issues and or IBS. I mean, this again could partly be due to where the endometrial tissues are growing, but also that some of the factors that go into some bowel conditions also can be a source of inflammation, and can also aggravate endometriosis. So definitely some of the things that we have also found is that actually by improving specifically bowel inflammation actually can ease some of the symptoms of endometriosis. Now, the other kind of factors that we also think about with digestion, and I know that when I talked about the estrogen progesterone imbalances, and I did a lot of focus on the liver, well, we actually also do process a lot of these toxins through our digestive tract. And so making sure that we do have a healthy digestive tract is really important for the excretion of estrogen, and specifically these xenoestrogens. Now, another interesting thing about our digestive tract is that we have, you might have heard of like the microbiome, and we have basically all this bacteria in our small and large intestine. And so some of these intestinal microbes actually help to regulate our three forms of estrogen. So the three forms are estrone, which is more the dominant estrogen of menopause; estradiol, which is the estrogen that most of us are probably mostly concerned about, and that's our primary estrogen of menstruation; and then lastly, estriol, which is more the estrogen that's associated with pregnancy. And so basically, these microbes actually do metabolize estrogen. And one of the problems is if you have an imbalance of some of this bacteria, specifically if you're having more what we consider like more pathogenic bacteria, what you might also then as a result, or we often call this intestinal dysbiosis, you're going to be having an increased circulation of some of these estrogens that you might not want, and so that accumulation of estrogen. So that being another factor of bringing that estrogen to progesterone out of balance. And then lastly, if we're talking about gut dysbiosis or imbalance of bacteria, specifically more bacteria that what we consider pathogenic, what you're also going to be seeing is an increase in lipopolysaccharides, which are LPSs, and these are produced by these bacteria, and they're a big source of inflammation. So if we be thinking about how endometriosis is very much associated with inflammation, some of that inflammation can be coming from our gut. And then also when our gut is inflamed, we're also going to be then having more what's called intestinal hyperpermeability, which is also something that we might have heard of as leaky gut. And again, that is just going to be more furthering this cycle of inflammation. So those I wanted just to kind of give you a little bit of a background on some of these causes, because it'll tie in very well when we talk about some of the dietary approaches and why we're recommending them. So let's now go and talk about some of the dietary approaches to endometriosis. Okay, so first, again, if we're thinking about inflammation, what are we thinking about and how are we going to target that from a dietary perspective? So the first would be identify and eliminate food allergies. So again, not across the board, but many patients that do have endometriosis do either have an allergy or intolerance to some of the big ones, which would be dairy, gluten, and eggs. Again, this is not across the board. And so when I'm seeing a patient for the first time, that is something that I want to definitely rule out either through an elimination challenge or doing some blood work to verify if they have any food allergies, because again, that's going to be a big source of inflammation. And then on the other side, so things to encourage to reduce inflammation. So increasing omega-3 rich foods, whether from fish, flax seeds is a really great, or flaxseed and flax oil. There's also, of course, obviously one can supplement with omega-3s, but there have been some pretty good research on how specifically omega-3 fatty acids can reduce inflammation and reduce pain associated with endometriosis, and that also that even that there can be even a reduction in the likelihood of diagnosis with women that consume more of these types of food. And of course, supplementation is also possible, but we can definitely get a lot of these omega-3 rich foods from our diet. And then also from an anti-inflammatory standpoint, increasing colorful fruits and vegetables. One, because you're going to get a wide variety of various antioxidants and phytochemicals, mostly from our vitamin A line, things like beta carotene, lycopene, also some of our other like polyphenols. So having a wide variety of fruits and vegetables, specifically thinking color, to really reduce inflammation. And then lastly, herbs and spices. So similarly, a lot of our herbs and spices have anti-inflammatory properties. I think probably the most famous one right now is turmeric, or you might know it from the supplement form as curcumin. Probably after that, ginger. So these, getting a lot of various herbs and spices in the diet can also help with inflammation. Okay, so talking about hormonal balance, and what are some of the strategies from a dietary perspective that we can do to help with hormones? Okay, so first, definitely as much as possible, buying organic foods. Specifically, definitely any of our, if we are having animal products, whether it's meat, poultry, eggs, dairy. I know that the previous slide I talked about that dairy and eggs can be food allergens for some patients. It's not necessarily always across the board, but making sure definitely that those are organic, but also from the produce side, the big concern is pesticides and how that can factor into hormonal imbalances. Now, that being said, if organic foods seem a little bit out of budget, the Environmental Working Group, which I talked about in a previous slide, the ewg.org, you can always go on their site, and they have two lists. One is called the Dirty Dozen, and so these are produce that you should definitely or absolutely should buy organic. Typically always on that list is apples and berries are always on that list. And then on the other list, which is the clean 15, these are various produce, fruits and vegetables that you don't necessarily have to buy organic for various reasons. Typically, usually banana is on that list, avocado, pineapple, and either it's because they tend to have a thicker skin, so that's not going to be as problematic, or some of these fruits and vegetables specifically are cruciferous vegetables, tend to almost have almost like a natural pesticide in them, so they don't need to be sprayed or heavily sprayed. Regardless, definitely, even if you're getting the clean 15, doing that whole strategy, I highly recommend definitely washing thoroughly your produce, just making sure that there isn't any residue at all. As I mentioned before, so cruciferous vegetables. So cruciferous vegetables, also known as brassicas, so these are things like cabbage and kale and broccoli and Brussels sprouts, definitely worth adding to the diet. And mostly one that cruciferous vegetables contain indole-3 carbinol, and then its more activated form, DIM. And what this does is it really helps to process estrogen. And again, if we think about estrogen imbalance, so it's going to really help to process estrogen. And there was an interesting study from 2004 that showed that women who ate cruciferous vegetables roughly twice a day or more were more than 70% less likely to have endometriosis than those who ate them less. So definitely worth adding to the diet, of course, if you tolerate it. Chia and flax and ground flax. We'll talk a little bit more about fiber in the next slide when we're talking about gastrointestinal health and it. But these definitely, again, we're thinking about how we do process or eliminate our hormones, not just in our liver, but also in our digestive tract. And so adding these ground seeds can be really effective. I know I talked a lot about plastic bottles and food containers. So the things on this bottom row are foods and substances definitely to avoid if you're wanting to get your hormones into balance. So again, I talked a lot about how these plastic bottles and food containers contain xenoestrogen, and it's definitely worse if it is heated, if there is an oil, or if there's an acidic medium. So that's definitely worse than if you're doing a cold storage of maybe just a dry cereal or something. So what to do instead? Things I definitely recommend, either if you're with your water, carrying it either in a glass container or one of these metal containers, something like a clean canteen. If you don't like New York tap water, there's definitely some really good filters out there. I highly recommend the Berkey, which is what I use. It is an investment, but over time you actually end up saving a lot of money with that filter. And then when it comes to food containers, if you're bringing food to work or just even storing it at the home, definitely glass, whether it's a mason jar or maybe also any kind of these. There's really good Pyrex right now where it has lids. There's some really great metal bento box style containers. And then of course, if you don't want to take the containers home with you, there's a couple of good lines of compostable deli containers. I actually have quite a few of those also in my house because my husband isn't able to bring things home with him. So putting leftovers in those types of containers work best. The other thing I'd also say about the food containers, being choosy about the restaurants that you might get takeout, because those plastic takeout containers also can leach a lot of endocrine disruptors. So definitely want to be aware of that. Alcohol. So alcohol, I would say, is twofold. So one, alcohol in general can just impact fertility. So typically when I'm working with patients that are trying to conceive, that is something that I put on my either reduce or hopefully eliminate list. But if we're thinking directly from a hormonal imbalance, again, as I said before, we're processing our hormones in our liver. So, and we process alcohol in our liver, and that's just going to be impacting our liver's ability to metabolize alcohol, plus the other, impact other factors that alcohol can disrupt that could lead to either in a direct way or indirect way. Alcohol does have an effect on cortisol levels. It can spike cortisol levels, which is our stress hormone. I didn't talk about it so much in the previous slide on the progesterone to estrogen balance, but we actually use progesterone to produce cortisol, so that can actually reduce progesterone levels in kind of an indirect way. And then lastly, alcohol does have a big impact on blood sugar regulation and insulin. And again, when we're seeing a lot of blood sugar spikes and insulin spikes, we're also going to be seeing increased estrogen activity, which again is something that we don't want. Okay, so as I was mentioning also earlier, specifically when we were talking about contaminants, dioxin, so both pork and beef, one, definitely if they're not organic, are going to have higher amounts of dioxin, actually being one of the leading causes or leading ways that we might be getting dioxin in our bodies. And we know now that dioxin is one of the leading chemicals associated with endometriosis. Plus the other is that many of the meat and pork products that we might be consuming also contain hormones, external hormones, so that they can grow. And so we're really seeing a big connection between overconsumption of pork and beef and endometriosis. In fact, women who ate ham 3 or more times a week were 80% more likely to have endometriosis. So pork is one of our fattest of meats. So it actually stores, so a lot of these toxins that we're talking about are fat soluble. So if we're also just thinking about meat or protein that we intake in general, beef and pork tend to have the highest fat percentage. So ideally, really either completely eliminating pork and beef, or if that doesn't feel like an option, only having the organic versions and still being very sparing with that. And then lastly, kind of a similar reason, so animal dairy. So both animal dairy, even organic, tend to want to avoid because it is full of hormones, even if it is organic, and mostly because what is animal dairy for? What is cow's milk, sheep's milk? But it's to provide nourishment to the baby calf, the lamb, uh, and basically it is full of hormones. Also, again, if we're thinking about dioxin levels, we're definitely going to be seeing more dioxin levels in the non-organic dairy. So that's another issue when it comes to dairy products. And then lastly, also that dairy products in general can lead to increased insulin production, which again, we know that insulin is very much linked to excess estrogen. So those are some other reasons why dairy may not be a great option if you have endometriosis. And so that's my little caution, keep out, don't have these. Okay, so for optimal digestion, let's see. So as I mentioned before in the previous slide on inflammation, definitely want to identify and eliminate food allergies, food intolerances, whether again it's through doing an elimination dietary challenge or doing a blood test because that is going to be a source of inflammation in the gut. And if we have more inflammation in the gut, we're going to most likely increase GI permeability, which will also perpetuate inflammation. So that's definitely very important. Okay, so fiber. So definitely want to make sure that we're getting enough both soluble and insoluble fiber. And that's not just to keep us regular, but it also keeps the microbes, the beneficial microbes that we want, happy. So definitely making sure that you're getting enough fiber. Typically, the recommended dosage of daily fiber for women is about 25 grams per day. So increasing fruits and vegetables, beans, grains, all these can definitely help to increase fiber. And then fermented foods. And I actually usually like to, I prefer recommending fermented vegetables because there's some other benefits with these types of vegetables. So things like sauerkraut and kimchi. You can also make things like pickled beets or pickled carrots. All of them have various lacto-fermented or lactobacillus bacteria, which can be very beneficial for endometriosis. I mean, there's one in particular strain, Lactobacillus gasseri, which you can get both in fermented foods, but also through taking a probiotic. Other fermented foods that I like to recommend is water kefir. So water kefir also has like a similar fermentation process using these grains, but instead of using a milk or a dairy medium, it uses water and produces a lot of bacteria. There is a beverage called Kefita, which is on the market, which is basically a water kefir or kombucha. And so increasing some of this beneficial bacteria. But again, if you don't link it with the fiber, the bacteria also does need fuel basically to produce all these specific compounds that are going to be really just optimal for digestion, things like butyrate. So that seems to be a very good combination when it comes to digestion. So to bring all this together, so what is an optimal endometriosis diet? So definitely, emphasis on clean, whole foods, low glycemic, low diet. So when we're talking about low glycemic, basically is making sure that what you're eating has a good fiber to carbohydrate ratio, healthy fats and protein, so that you're not getting these insulin spikes. And so just to get a little bit more specific, so for vegetables, I typically usually will recommend 4 cups a day, with at least half of those like broccoli and cabbage and cauliflower. Fish, specifically our high omega-3 fish, 3 to 4 times a week. Again, if you're concerned about any kind of toxicity with fish, you can definitely go to the environmental working group, or also the Monterey Sea Aquarium also puts out a safe seafood guide. And of course everything is always changing, but what we're talking about really is our omega-3 rich fish, and also smaller, it tends to be better. So things like sardines, for example, can be a really good way of getting those omega-3s. And then if you get it with the bones, you're also getting a little bit of calcium with that. Berries, so about a cup a day. I definitely usually recommend that. And I will talk a little bit. So there is a smoothie that I'll often recommend for my endometriosis patients that combines berries and anti-inflammatory spices and vegetables. And I find that that can be a really good part either as a breakfast or part of a snack, as a way of really making sure to be getting a lot of these different groups that are going to be beneficial. I also recommend about a half a cup to 1 cup cooked daily of beans, legumes, lentils, great source of fiber, great source of protein, vegetarian protein. I'm not saying that everyone needs to be completely either pescatarian or vegetarian to have an optimal endometriosis diet, but the more that there can be a plant-based emphasis, the better. Nuts and seeds, about like a quarter cup daily, or 2 tablespoons of a nut butter. I also recommend getting about 1 to 2 servings of a fermented food, specifically the fermented vegetables, per day to really support healthy digestion. I just say daily, so daily, like really spicing your foods up with a lot of different herbs and spices. As I mentioned before, definitely turmeric, definitely ginger, all are very associated with reducing inflammation, but there's so many other herbs too that could also be added. Another big one that's very popular right now is black cumin seeds, so that can be something else to add to your dishes to help to reduce inflammation. And then flax and chia seeds, specifically the ground one, are definitely best. So about 2 to 4 tablespoons per day. And so these are the foods. So the optimal diet would not be limited to these foods, but really encouraging daily consumption or weekly consumption of some of these foods to help reduce endometriosis and the symptoms. I didn't put it on this list because it's very specific to the patient, but definitely if a food allergy or intolerance is identified, making sure to eliminate those, as well as reducing or eliminating alcohol, red meat, pork, and again, animal dairy. Okay, so that's my presentation. Thank you so much. I'm happy to answer any questions anyone might have. And then also, if you're interested in the smoothie I was talking about that I've been recommending for many of my patients, you can definitely email me and I'm happy to share that smoothie recipe with you.